A million. What are we talking about here? We are talking about the U.S. is now averaging more than 1 million COVID-19 boosters daily. About 52% of vaccinated seniors over the age of 65 have now been boosted. Right? That's a
that
good
number in that age group definitely needs to go up quickly. But yes, we're a step in the right direction.
And especially in these times, maybe some of these headlines will encourage people, but we're starting to see cancellations now of shows, gatherings, trips, schools. This is an indicator of what we're dealing with Omicron, and this is just, beginning.
Right. We're just in the beginning of this Omicron wave that's sweeping this country. And again, as we've talked about before, there's how the virus behaves and there's how we behave. So when you take a look at that in this setting of these rapidly increasing numbers, most cases, yes, are mild, especially when they are the so-called breakthrough cases in people who have been boosted or have had their full vaccination regimen. However, the issue, mild to the individual does not mean mild to the population. The issue is the potential disruption of workplace, holiday gatherings, plans, the potential for major staffing shortages, and not just in the hospital, but in any workplace. Hospitals now at or over capacity in many parts of the country. And of course, that's a real issue for everyone. So it's not just, it's mild for one person, so we don't have to worry about it. It's the global impact that could be so devastating.
And we certainly expect probably family gatherings. At least the plan was that they would be bigger than they were last year.
Right.
But now there's some recommendations about doing some rapid tests for folks who are going to be gathering.
Yeah, and I've been hearing this question from a lot of my patients, a lot of my friends and relatives. They're leaning into this recommendation from the CDC about doing a rapid test before you gather with people who are not in your household. But here's what you need to know about that. If you get a positive result on a rapid test, which has about 90% accuracy, believe it. Start your isolation 10 days from that moment. That's the recommendations. Assume it is a true positive. Sure, if you want to confirm it with a PCR, be in touch with your healthcare provider. Absolutely do that. And a negative, the best reassurance we could have right now. But remember, again, there's always the possibility that you could test negative today and tomorrow test positive. So again, they have a place, they have a role. Use them, especially if you're going to be getting together in the next couple of weeks.
And those home tests, I've seen them stacked up
I
at
know.
Dwayne
You
Reed.
dumped a bunch off in my dressing room today for me because you had some extras.
Yep.
Treats me like a rapid test pusher. Yo, TJ, you got the stuff?
You got any more?
All right, Dr. Ashton, thank you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.